So World Tuberculosis Day is Sunday, March 24th. Yes, we can end TB continues to be the theme as TB is still one of the world's deadliest diseases with an increasing drug-resistant TB in recent years. This day is a reminder to everyone the impact of TB around the world and the importance of educating the public about tuberculosis. On March 24th, 1882, the bacteria that causes TB, Mycobacterium tuberculosis, was first discovered by Robert Koch. This proved that TB was an infectious disease and not hereditary. Some history around TB. Johann Schlein first used the term tuberculosis in 1834. There have been multiple names in the past used for TB. Phthisis in ancient Greek, Tabes in ancient Rome, Shashapeth in ancient Hebrew, and in the 1700s, the White Plague and consumption. TB can be traced back 9,000 years in the Atlit Yam, a city under the Mediterranean Sea, and the remains of mother and child buried together. Other earlier written mentions of TB date back to India 3,300 years ago and in China 2,300 years ago. In the 16 and 1800s in Europe and in the United States, TB has caused 25% of all deaths. The first published report of TB was in New York City in 1893, and in 1889, Dr. Herman Biggs pushed for the Department of Health and Hygiene to require doctors to report TB cases to the health department. The first nationwide publication of TB data by the CDC was in 1953, reporting 84,304 cases of TB in the US. TB is also not found just in humans. They can be found in animals, cattle, and deer. Yearly, approximately 1 million cattle are tested each year. I will now hand it over to public health nurse Jennifer Almonte to go over more details about TB testing and treatment.
Great.
Hi, thank you. As the public health nurse, I see TB patients out in the community. I think it's very important with TB is to differentiate some of the misconceptions that lie around TB. When we think of TB, we usually think of the pulmonary TB. The reality is that TB is a bacteria, and it causes infection in the body, and it's not only infection in your lung, it could affect different organs of your body, and the presentations would depend on which organ it's affecting. So TB disease is caused by germs, a bacteria that spread from person to person through the air. TB usually affects the lungs, but it can also affect other parts of the body, such as the brain, the kidneys, or the spine. And not everybody infected with TB germs becomes sick. As a result, there's two TB-related diseases. There's one that's called inactive TB or latent TB, and then you have the active TB disease with somebody that has symptoms. So what's the difference between the two of them? Well, in both cases, they were exposed to somebody with TB. They have the germs in them. Somebody with an inactive TB has a small amount of the germs in their bodies, but the germs are inactive. They have no symptoms, so they don't feel sick, and they cannot spread TB to other people. They may have a blood test or a skin test that's positive, or they may have a normal chest x-ray and negative like spit test, sputum smears. This person would need treatment for inactive TB, and that's something that a doctor's office would be able to determine. Now, somebody that has active TB now has symptoms, and they have a large amount of active TB germs in their body. They're feeling sick, and they may spread it to other people. They usually have a positive blood test indicating TB infection. It could be a blood test or a skin test. They may have an abnormal chest x-ray if it's in their lungs, and they would need treatment for active TB disease. And again, just to say, TB, again, it's not only in your lungs, it could be in different parts of your body, so some of the symptoms would be consistent with the organ that it's affecting. Signs and symptoms for the classic TB, where you see it in the lungs, it's cough that lasts 3 weeks or longer, cough up in the sputum, or coughing up blood in sputum, weight loss, fever, night sweats, chest pain, loss of appetite, weakness or fatigue. And when we say weight loss, we're talking about you're not trying to lose weight and you just continue to lose weight for no known reason. The treatment for TB is antibiotics. So if you have inactive TB, they would treat you with antibiotics. If you have active TB, it would be more antibiotics, but it's still antibiotics is the course of treatment. Very importantly is that people have to finish their TB treatment because TB, the organism is very smart and it has the ability to mutate. So in the event that it does mutate, then the drugs that you may be taking for it are not going to be effective. So the TB germs can live in your body for years without causing symptoms. If you have inactive TB, treating is the best way to prevent and protect you from getting sick with active TB disease. If you have been diagnosed with active TB, you can be treated with medicine. And again, you need to finish all of your TB treatment as it is directed by your doctor or nurse, and this helps you feel better and prevent other people from getting sick. The best way to remember to take your TB meds is, if you have active disease, is to have a nurse, like a public health nurse like me, go out in the community and do what's called DOT, direct observation therapy. When we go out into the patient's home to do this, it's not only to make sure that they're tolerating the meds, but also that they complete their treatment. And if there's any communications that need to happen with the doctor or clinic, the TB nurse facilitates those conversations. And we always want to make sure that the TB treatment is working as it should. If there's any changes need to be made, that's something that's a conversation that we have. Getting tested is the best way to know. And there's two different tests that you can have. You can have a blood test or you can do a skin test. For many people that are born outside of the U.S., they might have gotten a BCG vaccine, and if you do a skin test, it might react to that. But if you do a blood test, the blood test does not react to the BCG. Either way, it's a conversation for you to have with your doctor, and they would determine which test would best suit you. If you have more questions about TB and TB disease, there's information packets here. You can contact me directly here in the health department, and the CDC has a wealth of information available to all. Thank you very much.